Okay, welcome to Talking with Docs.
I'm Dr. Brad Weenie.
And I'm Dr. Paul Zales. So we have a really cool video today. We're just going to answer a question that my patients ask me all the time. They always ask, how do I know if and when I need a knee replacement?
That's a tricky question. So I guess the first thing to tell people is that no one has to have one. It's not cancer, it's not an infection. For arthritis, you don't have to have one, but you might feel like you have to have one.
Right, I agree totally. I mean, I tell people you don't need a knee replacement. It's a treatment option that's available to you.
That you want one.
Yeah.
You don't necessarily need one.
I mean, occasionally if you have like a cancerous lesion that has to be excised and you remove the joint and then you need to have a knee replaced. But 99.9% of the time you don't need a knee replacement, but you may want to have one to relieve your symptoms.
Right, so to answer the if part in my office, I want to make sure that they have a condition that would benefit from a knee replacement. So I want them to have advanced arthritis of their knee. So usually that's confirmed with a physical examination and an x-ray.
I agree, and I use the x-ray. I look at the x-ray, I just answer one question. Looking at this x-ray, is there a good chance that a knee replacement will relieve your pain? And I can answer that question by looking at the x-ray. If there's like minimal arthritis or no arthritis on the x-ray, then I say no, a knee replacement probably won't help you. However, if there's bone-on-bone articulation there's no more cartilage, then yes, a knee replacement does have a good chance, not guaranteed, but a good chance of relieving your pain.
Yes, but similar to that, you could have someone that comes in with a knee x-ray that looks like that, but they say, I'm not really that sore, I'm not stiff, I like to run 10 kilometers a day, and I'm an avid hiker and skier, and I say, you definitely should not have a knee replacement because I can't help you with this metal and plastic implant.
Good point. So let's say I look at the x-ray and say, yeah, a knee replacement has a good chance of helping you and relieving your pain, but if you're not having pain, Jimmy cracked corn,
Yep.
don't replace your knee.
Don't replace your knee. So yeah, the key is finding appropriate pathology and then correlating that with the symptoms that you have and then making a decision together. But ultimately, I'm like you, once I feel they have a knee that's worthy of a knee replacement, I put it back to the patient and say, listen, do you feel like your life is negatively impacted enough to get one? Yeah. It's a big deal.
Sure, in the old days, the orthopedic surgeon said, yeah, you need a knee replacement, bang, book it, replace your knee. Nowadays, we make the decision together. The physician and the patient make the decision together, and everyone has a different threshold. Some people are like, well, I can't golf anymore, I can't work, I can't sleep at night, it's waking me up, and that's their threshold. Say, okay, I got to replace my knee.
Yep.
Whereas others are like, you know what, I can still get around, I can still walk for 10 minutes, 15 minutes, I can still make it from my room to the dining room, I don't need to replace my knee.
Yeah, so there's a whole multitude of factors that go into it, surgical ones, patient ones, surgeon ones, and then you have to decide together to come down to a final decision.
So we kind of didn't answer the question, how do I know when I need a knee replacement?
You'll just know. A whole bunch of people will decide together and then you'll just know.
I would turn it around and ask you, how will you know when you need a knee replacement? And you have to set your threshold and decide, okay, I'm in enough pain that yeah, I would consider this surgery.
The other thing I would say is that you've done everything else. So you've done all the non-operative stuff that we talked about in other videos. Pills, needles, bracing, physiotherapy, activity modification, weight loss. Once you've done all of that and you're still sore, then maybe it's the answer.
Yada, yada, yada.
Yeah,
exactly. Definitely check out our other videos where we talk in a lot more detail about it. But just as a quick answer to that question, we hope we gave you some insight to it.
So if you like this video, please like it and subscribe to our channel.
And if you're watching it on YouTube, remember to watch it on Instagram. If you're watching on Instagram, remember to check it out on YouTube.
See you next time.